Welcome to Hemoviv. Today we're starting our blood health series with an essential topic, anemia, one of the most common blood disorders in the world. Let's understand what it really is, how it affects your body, and why it happens.
What is anemia? Anemia describes a condition in which the number of red blood cells, or hemoglobin in the blood, is low. For this reason, doctors sometimes describe someone with anemia as having a low blood count. A person who has anemia is called anemic. The normal level of hemoglobin is generally different in males and females. For men, a normal hemoglobin level is typically defined as a level of more than 13.5 gram, 100 milliliters, and in women as hemoglobin of more than 12.0 gram, 100 milliliters. How does the body make blood? Blood consists of two parts, a liquid called the plasma and a cellular part. The cellular part contains several different cell types. One of the most important and the most numerous cell types are red blood cells. The other cell types are the white blood cells and platelets. Only red blood cells are discussed in this article. The purpose of the red blood cell is to deliver oxygen from the lungs to other parts of the body. Red blood cells. Red blood cells are produced through a series of complex and specific steps. They are made in the bone marrow inner part of the femur and pelvic bones that make most of the cells in the blood, and when all the proper steps in their maturation are complete, they are released into the bloodstream. The hemoglobin molecule is the functional unit of the red blood cells and is a complex protein structure that is inside the red blood cells. Contrary to most cells in the human body, red blood cells do not have a nucleus metabolic center of a cell. Red blood cells live about 100 days, so the body is constantly trying to replace them. In adults, red blood cell production occurs in the bone marrow. Doctors try to determine if a low red blood cell count is caused by increased blood loss of red blood cells or from decreased production of them in the bone marrow. Knowing whether the number of white blood cells and/or platelets has changed also helps determine the cause of anemia. The main causes of anemia are blood loss. Blood loss is the most common cause of anemia, especially iron deficiency anemia. Blood loss can be short-term or persist over time. Heavy menstrual periods or bleeding in the digestive or urinary tract can cause blood loss. Surgery, trauma, or cancer also can cause blood loss. If a lot of blood is lost, the body may lose enough red blood cells to cause anemia. Both acquired and inherited conditions and factors can prevent your body from making enough red blood cells. Acquired means you are not born with the condition, but you develop it. Inherited means your parents pass the gene for the condition onto you. Acquired conditions and factors that can lead to anemia include poor diet, abnormal hormone levels, some chronic ongoing diseases, and pregnancy. Diet. A diet that lacks iron, folic acid folate, or vitamin B12 can prevent your body from making enough red blood cells. Your body also needs small amounts of vitamin C, riboflavin, and copper to make red blood cells, conditions that make it hard for your body to absorb nutrients. Also can prevent your body from making enough red blood cells. Diseases and disease treatments. Chronic diseases, like kidney disease and cancer, can make it hard for your body to make enough red blood cells. Some cancer treatments may damage the bone marrow or damage the red blood cell's ability to carry oxygen. If the bone marrow is damaged, it cannot make red blood cells fast enough to replace the ones that die or are destroyed. People who have HIV, AIDS may develop anemia due to infections from medicines used to treat their diseases. Pregnancy. Anemia can occur during pregnancy due to low levels of iron and folic acid and changes in the blood during the first 6 months of pregnancy. The fluid portion of a woman's blood, the plasma, increases faster than the number of red blood cells. This dilutes the blood and can lead to anemia, aplastic anemia. Some infants are born without the ability to make enough red blood cells. This condition is called aplastic anemia. Infants and children who have aplastic anemia often need blood transfusions to increase the number of red blood cells in their blood. Acquired conditions or factors, such as certain medicines, toxins, and infectious diseases, also can cause aplastic anemia. Both acquired and inherited conditions and factors can cause your body to destroy too many red blood cells. One example of an acquired condition is an enlarged or diseased spleen. The spleen is an organ that removes worn-out red blood cells from the body. If the spleen is enlarged or diseased, it may remove more red blood cells than normal, causing anemia. Causes of anemia. Anemia caused by blood loss. Anemia caused by decreased or faulty red blood cell production. Anemia caused by the destruction of red blood cells. Long-term alcoholics. Strict vegetarians are at risk if they do not take adequate vitamin supplements. Poor iron intake and diet. Poor iron absorption in the body. A wide assortment of bone marrow diseases can cause anemia. Anemia could be hereditary also, such as sickle cell anemia and thalassemia. Certain drugs, medicines, radiation therapy, chemotherapy, and infections may also deplete the body iron by causing RBC destruction. The most common types of anemia are iron deficiency anemia, thalassemia, aplastic anemia, hemolytic anemia, sickle cell anemia, pernicious anemia, Fanconi anemia. The most common form of anemia is iron deficiency anemia, which is usually due to chronic blood loss caused by excessive menstruation. Increased demands for iron, such as fetal growth in pregnancy and children undergoing rapid growth spurts in infancy and adolescence, can also cause iron deficiency anemia. Aplastic anemia. Aplastic anemia is a blood disorder in which the body's bone marrow does not make enough new blood cells. This may result in a number of health problems, including arrhythmias, an enlarged heart, heart failure, infections, and bleeding. Aplastic anemia is a rare but serious condition. It can develop suddenly or slowly and tends to worsen with time, unless the cause is found and treated. Hemolytic anemia. Hemolytic anemia is a condition in which red blood cells are destroyed and removed from the bloodstream before their normal lifespan is up. A number of diseases, conditions, and factors can cause the body to destroy its red blood cells. Hemolytic anemia can lead to various health problems such as fatigue, pain, arrhythmias, an enlarged heart and heart failure. Thalassemia. Thalassemias are inherited blood disorders which cause the body to make fewer healthy red blood cells and less hemoglobin and iron-rich protein in red blood cells. The two major types of thalassemia are alpha and beta thalassemia. The most severe form of alpha thalassemia is known as alpha thalassemia major or hydrops fetalis, while the severe form of beta thalassemia is known as thalassemia major or Cooley's anemia. Sickle cell anemia. Sickle cell anemia is a serious disease in which the body makes sickle-shaped red blood cells. Normal red blood cells are disc-shaped and move easily through your blood vessels. Sickle cells contain abnormal hemoglobin, which causes the cells to have a sickle shape, which do not move easily through the blood vessels. They are stiff and sticky and tend to form clumps and get stuck in the blood vessels. In sickle cell anemia, a lower than normal number of red blood cells occurs because sickle cells do not last very long. Sickle cells usually die after about 10 to 20 days, and the body cannot reproduce red blood cells fast enough to replace the dying ones, which causes anemia. Pernicious anemia. Pernicious anemia is a condition in which the body cannot make enough healthy red blood cells because it does not have enough vitamin B12, a nutrient found in certain foods. People who have pernicious anemia cannot absorb enough vitamin B12 due to a lack of intrinsic factor, a protein made in the stomach. However, other conditions and factors can also cause vitamin B12 deficiency. Fanconi anemia. Fanconi anemia, or FA, is a rare, inherited blood disorder that leads to bone marrow failure. FA is a type of aplastic anemia that prevents your bone marrow from making enough new blood cells for your body to work normally. FA can also cause your bone marrow to make many abnormal blood cells. This can lead to serious health problems, such as leukemia. FA is a blood disorder, but it can also affect many of the body's organs, tissues, and systems. Children who inherit FA are at higher risk of being born with birth defects, and people who have FA are at higher risk of some cancers and other serious health problems. FA is an unpredictable disease.
So that's a quick overview of what anemia is and how it affects the body. In our next video, we'll dive into the symptoms of anemia, what to look out for, and when to see a doctor. If you found this video helpful, make sure to subscribe to Hemoviv, hit the bell icon, and share this with someone who might need it. Thanks for watching, and remember, your blood is your life, so keep it healthy.